Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update for the week ending May 6th, 2021. This week, as every week, my first question is, how is the pandemic progressing globally in the U.S. and in our region? And then a second question, which is related to that, which is, are we progressing towards herd immunity? In terms of the global pandemic, it's a mixed story. We've had 3.25 million deaths worldwide. And last week, there was a 3.1% increase in the total number of deaths. That's the largest increase we've seen since the second week of February. So that's quite worrisome. Almost 100,000 deaths around the world last week. That's about 9.5 deaths every minute. So this continues to be a very serious pandemic globally. And if you look at the number of daily deaths, you can see that in the last couple of days, the number has exceeded any time except the very worst times in January and early February. So the pandemic is being a significant public health risk around the world. When you look at the 9 most impacted countries in terms of cases, we see very different patterns, however. We see the pattern in India with a very rapid growth in the number of deaths. We see the same pattern in Turkey. We were seeing the same pattern in Brazil, though it seems to be coming down a little bit. Really, of the 9 most impacted countries in terms of cases, the only one that appears to have their death rate really coming down towards zero is the United Kingdom. Most of the rest, Italy, Spain, France, and increasingly worrisome, the United States, seem to be leveling off. And that's not what we want to see. We certainly don't want to see the spike in deaths that they're seeing in some other countries. But it's worrisome that for weeks and weeks now, France has seen basically the same number of daily deaths, and we seem to be entering the same pattern. In terms of total number of cases per million, the U.S. is still in 12th place. We've had about 1 death for every 530 people in our country. In terms of total deaths in the U.S., we're getting very close to 600,000 deaths. And last week, we had a 0.9% week-to-week increase. That's much less than the 3.1% the world's seeing. But it's a little bit worrisome that this is the 4th week in a row that we've had a 0.9% increase. I'm glad to see it below 1%, but I'd really like to see it start to drop down even below that. In the U.S., there were about 5,000 deaths last week, and that's about 1 death every 2 minutes. And I showed you this pattern before. In March and April, there was a spike in deaths. Then it seemed to come down and stayed fairly level for much of the summer. And then it spiked again in November, December, January, February. And now it's coming back down, but now leveling off again. And it's a little bit worrisome that this leveling off is about where the U.S. was from May through October of last year. So clearly the pandemic is not going away just yet. This is where we were in August, September, October, November, December, January, February, March, April, and now the first week of May. And we can see clustering of cases here in the southeast, in the north central part of the country, and in the southwest as well. Again, it's a pandemic that's impacting everyone around the country. In terms of the 5 states in our region, all of them seem to be having the pattern that the U.S. had, the spike and then coming down, the spike coming down and then leveling off, the spike coming down and leveling off. In Virginia and South Carolina, the numbers seem to be a little bit lower than they are in North Carolina and Tennessee and Kentucky, but it's something to keep an eye on. In terms of the week-to-week percent growth rate, Tennessee leads the pack now at 0.3%, which is where we'd like to see everybody, but they're all about the same range. In terms of the Ballad Health Service area, over 2,000 deaths have occurred since August. Again, 0.9% increase in the past week, the same rate that the U.S. has had overall. But that's still 18 deaths last week. That's 2.5 deaths a day. So clearly the pandemic isn't over in our region either. In terms of hospitalizations, you'll remember we were following this in August, September, There's about 100 COVID hospitalizations in the Ballad health system. Then it spiked up to 350, then came back down. And we've been following this upward trend. This week, it's just over 100. So hopefully we're seeing this leveling off again. Though if you think about it, 100 hospitalizations is still pretty serious. So globally, the pandemic is burning out of control. Particularly in India, Turkey, and a few other countries. In the US, it seems to be leveling off, not coming down as much as I'd like, and the same is probably in our region. So again, we're not out of the woods yet. This is still a major public health problem. One of these solutions that people have proposed is reaching herd immunity. This is the idea that enough people will be immune to a disease that it will stop spreading. And the idea is you can get immunity through either vaccination or having had the disease. Since the disease is pretty serious and a number of people die, almost 600,000 in the US, it's obviously better to get the vaccine than it is to get the disease. In terms of where we are in the US towards herd immunity, sort of a low estimate is there have been about 10% of people in our country have been documented to have a natural infection. They've been infected, and about 32% have been fully vaccinated. Now, there's some overlap between these two groups. So I estimate that a low estimate, about 39% of Americans are probably immune. Now, we know that a majority of people who get infected are never diagnosed. The CDC has estimated that there are 4.6 infections for every one that we know about. And there's a significantly higher percent of people who've had a single dose of the Moderna or the Pfizer vaccine, which does provide some immunity. So if we put those together, we'd estimate that high estimate somewhere about 70%. So somewhere between 40 and 70% of the US is probably immune now. If you take a halfway point, maybe 50 to 55%, which is a good progress towards the herd immunity, which most people think is probably at least 80%. It depends on how easy a virus is to spread. For a disease like measles, you need about 95% immunity to prevent spread. In terms of Tennessee, we've had more infections, about 10% more than the US, but we've had less vaccinations. So a low estimate is about 36%. A high estimate is about 71%. So again, about where the US is, maybe slightly lower in terms of our immunity. And we're probably somewhere around a little over halfway, maybe 2/3 of the way towards herd immunity. Well, all of that is fine, but there's increasing concern that we might not reach herd immunity. We may not be able to reach it. And the idea is this. The more a virus circulates, the greater a chance it'll mutate. As it gets into someone's body, it explodes, explosive growth. Well, when that happens, mutations happen. Many of the mutations are not significant. The virus just dies off. But some of the mutations can make the virus easier to spread, more transmissible, more lethal, causing more serious disease. And of real concern is it's possible that these mutations may make the virus more likely to avoid the body's immune system. So whether you're immune from natural disease or the vaccine, if a virus were to come along, you may not be protected against it. All right. So again, the more a virus circulates, the greater a chance it will mutate. And there are several major populations in which the virus is circulating widely. The first is people who won't get the vaccine. Right? And they won't engage in safe practices. The New York Times this week had this map that shows where people are less likely to get the vaccine. The darker counties are the ones where people are more likely to get it, and the lighter counties are ones where they're less likely to get it. And I don't have to point out to you which areas of the country appear to be less likely to get the vaccine, and therefore more likely to see continued spread of the virus over time. But there's other populations as well, and particularly people who can't get the vaccine, at least not right now. That's children, and people in other countries. Children are not yet approved for the vaccine. And yes, they do get the disease. They do get sick. And they don't get sick as much as older folks do, but they can still spread it. And then, of course, if the virus is spreading widely in other countries, just as it spread around the world last year in January, February, March, it'll keep spreading and it'll keep coming into our country. We can put travel restrictions up, which do make sense, but you can't stop the virus from traveling unless you completely shut your borders down. And that eliminates all sorts of trade and tourism and all sorts of things. So as long as the virus is spreading in children or in other countries, it will keep mutating. And the more it mutates, the greater a chance that something will happen that will prevent us from getting to herd immunity. So right now, what we need to do is we need to get as many people vaccinated as possible, not just in the United States, but around the world. Because if we don't control the spread of this virus, it'll continue to mutate. Now, some are suggesting that it may mutate and become like the annual flu. That could happen. And it could be that we'll have to get vaccines every year, or a booster, or a new vaccine. We just don't know yet. Right now, the best thing we can do is to work together to try to eliminate this infection from as many places and as many people as possible. And the very best way we can do that right now is with vaccines. There's a great deal more information about COVID-19 on the College of Public Health website. If you're sharing this video with others, please let Jan Stork know. We'd be happy to add them to our mailing list. I'd like to thank Melissa White for helping collate the data and Dara Young for editing, producing, and posting this video. And as always, the most important thing for me is to get feedback from you. Are these videos helping? Are they helpful? Do they provide information that you need? Oftentimes, if I do get questions from you, I'll try to answer them independently outside of these videos by return email. And sometimes I'll take the questions and incorporate them into my weekly updates. But I look forward to hearing from you. Until next week, please be well. Thank you.